isometric exercises for knee arthritis. So now I'm going to demonstrate some isometric exercises that you can do to treat knee arthritis. You think about isometric exercises, these exercises, you are holding a position. And the advantage here is that you can do the exercise for the knee joint while you are in a pain-free zone. For example, one of the common exercises used to help treat knee arthritis would be the traditional bodyweight squat. Sometimes a therapist may ask you to do this exercise when you're at home to help to build back up strength into the knee joint. However, for some people, this can be very painful. Some people, after they reach this point here, is very painful and they can't go below that. So how do we deal with this limitation? What we can do, we can have the person go down to the point, stay in the pain-free zone, and then you hold the position. Hold it for 10 to 30 seconds. It all depends on what your capabilities are. So a person can do this exercise, stay in the pain-free zone, hold the position, start building up strength in the quadricep muscle. When you're done, when the person is finished, one of the isometric exercises you can use to build back up strength in the knee joint. The next one would be the wall sit. You can lean against a wall, put the feet out in front of you, and again, you come down to the point. I'll stay just above that painful zone, lean against the wall, and then I will let the quadriceps do the work to support the body. Again, you're holding for time, 10 to 30 seconds. If you can go a bit longer, that's fine. As you get stronger and stronger, what you can do, you can take some weights to make the exercise a bit more challenging. And when you finish, come out of it. Now, you can hold the position at different angles. So let's just say for the first round, I was at this level. And then for the second set, I may not go as low, I can probably go up a bit higher. I'm going to train the knee joint at different angles. You don't need to hold it just at one angle. You need to train it at various angles. You go a bit higher, or let's just say for the first set, I was this high. Then for the second set, I may go down a bit lower, still staying in the pain-free zone. Right. I go down a bit lower, hold the position for 10 to 30 seconds. And as time goes by, what you would find is that you'll be able to go a bit lower and lower and lower. And the zone that would normally be painful, you would find that you are actually able to get into that position with less difficulty over time. So the next exercise would be the heel raise. That can be done on a stair or on the flat floor. Let's do it on the floor. So you do tiptoe, and you just hold this position. Hold the position for 10 to 30 seconds. It all depends on the strength levels. People with knee arthritis may also have some ankle issues as well. So this will also help to strengthen the ankle. And then when you're done, come down slowly. As time goes by and you get stronger and stronger, what you can do, you can probably use a one-leg version of the heel raise. So instead of using both feet, use one. Come up, hold the position, 10 to 30 seconds. Strengthen the calf muscles, very important. Come down slow. The next exercise you can do is to strengthen the anterior tibialis, or the shin muscle. This muscle pulls the foot up like this. So what you can do, lean against the wall, feet out a bit in front of you, and you raise the toes. This exercise looks deceptively easy. You will find after 20 seconds, those muscles are really going to begin to burn you. But this exercise helps with the knee stability. 10 to 30 seconds, it all depends on your strength level. And when you're done, bring it back down. Isometric lunge. So for this exercise, you're going to split the legs, get some support, stand next to a wall or maybe a steady piece of furniture, and you're going to bend forward like this here. Again, just for argument's sake, let's just say this knee was getting painful by the time I reach this position. So what I can do, I can just come down to the point just before the pain starts, just hold the position right here. So I'll strengthen the muscle. I will stay in the pain-free zone, 10 to 30 seconds. When you're done, come out of it. And you switch your legs, lunge forward again, stay in the pain-free zone, stay out of the painful zone, hold for 10 to 30 seconds, then you come out of it. Then for the next round, what you can do, you can try a different knee angle. So instead of going all the way down to this point, for your next set, probably go up a bit higher, use the wall for support, 10 to 30 seconds, and you come out of it. So that is the isometric lunge. Once again, the isometric exercises allow you to work the muscles in the pain-free zone, so that way you can actually get the work in. A lot of people don't do the exercises because it's painful. This is a workaround for you to exercise, even though certain positions of the knee joint may be painful. isometric bridge exercise. This exercise will target the hamstring. So you just lie on an exercise mat or lie on the floor. Okay, so for this exercise, you're going to lift the buttocks off the mat right here. Just hold it. You may begin to feel some cramping in the hamstring. If you have knee arthritis, a lot of times when you begin to do isometric exercises, it tends to make you a bit more prone to muscle spasm because you're not really using the muscle like you used to in the past. But this exercise will help to strengthen the glutes as well as the hamstring. And then you come down. Now, as you get stronger and stronger, you can take a weight and put it on the stomach and do the exercise again. Or if you don't have a weight, you can do the one leg version. Take one leg out of the equation, come up like this, and you begin to feel the hamstring work a bit harder because now only one leg is supporting your weight. And then when you come down slowly. Now, if the hamstring is beginning to cramp up on you, what you can do, you can stretch it. Just put your hands here and pull towards you to remove the spasm in the hamstring muscle. Bring it back down like this. Okay, so that's the isometric bridge to help to strengthen the hamstring. Again, you can play with the ranges. So let's say on the first set you came all the way up here and you held this position. On the next round, you can probably come a bit lower. Hold for 10 to 30 seconds. So you keep playing with the ranges, but you're staying in the pain-free zone. And again, with time, you will see you will begin to be able to bend the knee more and more and with less pain or less discomfort. Come back down. So that's the isometric bridge to help to strengthen the glutes and the hamstring. So I hope you now understand how isometric exercises can be used to treat knee arthritis. If you would like to get therapy for knee arthritis, you can call or WhatsApp 747-5297 or 308-3370. You can also WhatsApp your x-rays on those numbers. We also offer knee injections such as steroid, PRP, and the gel injection. We are located at number 4 Chincuna Gardens in Chincuna Road in Cunupia.